Now we discuss a very common issue that we can see in our society. In fact, it happens so often. You can see it almost everywhere, but probably you have not actually paid attention to it. So this is what is known as a leg length inequality. So your two legs, okay, this is what the true leg length inequality. So your two legs, their lengths are not the same. So it's also called leg length discrepancy. It's a condition where one leg is shorter than the other. So it can be structural, where there's a true difference in the height, or it could be functional, where the legs are not appearing to be abnormal simply because you have an underlying medical condition like muscle imbalance or joint contractures, those osteoarthritis, you had an injury there, so you're just limping. Do you understand? So types, we have the structural, which is a true discrepancy caused by differences in arterial bone length. It's due to congenital conditioning or growth plates in injury or bone disease. They will have the functional one, which I told you guys is due to an underlying medical condition. Causes could be they born you, they just give birth to you with that issue. So developmental dysplasia of the hip, hemihypertrophy, congenital femoral deficiency, all of these we are going to talk about them. So sometimes you acquire it later on in life due to traumas, infections, tumors, or surgeries. They did a surgery for you, so the side effect of the surgery, neurological conditions and arthritis. So we say, so such people, there's a way their hip is tilted, one side is higher than the other side. Okay, you call that the Treadle-Lundberg sign, right? So clinical features, there's limping or gait abnormality, hip pain, knee pain, back pain, pelvic tilt or scoliosis. Then there's visible differences in the leg length. You diagnose it from tape measurement, then block testing. Okay, you tell the person to stand straight, so the leg that is short, to keep adding some blocks of known heights. So when you balance up, you now know the amount of height that the person is needing on the other side. Also x-rays, CT scans and MRIs. Management is if it is asymptomatic, that the leg length is just very small, just leave it. But if it is moderate, you now have to do special shoes. One shoe will be having a higher sole than the other. There are also physiotherapists. Okay, then sometimes they can go in for surgery like what epiphysiodesis, limb lengthening techniques, and shortening procedures on the other longer leg. Okay, so this is what we got.